In a world reshaped by the COVID-19 pandemic, the silent crisis of mental health has risen to the forefront, demanding our collective attention. In Nigeria, a country of vibrant energy and unyielding spirit, mental health struggles have too often been overshadowed by stigma and limited resources. But amidst the challenges lies a story of hope, a story of resilience, innovation, and a commitment to change. The Sunshine Series and the Idimma Health Initiative has been a beacon of light, empowering minds and transforming lives. Through groundbreaking solutions like accessible psychotherapy, training for lay counselors, and the toll-free 112 helpline, they've paved the way for a healthier tomorrow. This documentary takes you on a journey through the untold stories of those who dared to seek help, the heroes who provide it, and the partnerships that make it all possible. Together, we explore the challenges, celebrate the milestones, and envision a future where mental health care is within reach for every Nigerian.
At the beginning of the COVID-19 pandemic, during the lockdown, obviously, like everyone else, we also went into lockdown. There wasn't much work to do. Everyone was scared, worried. Everyone was so uncertain about the future. But something interesting happened. We saw a rise in people talking about their mental health on social media. A lot of people were stuck in lockdown alone without family or any support system. A lot of people lost their jobs. A lot of people had health challenges. So we saw increase in conversations going on around mental health, how the pandemic was affecting mental health. We saw a rise in suicide cases amongst frontline workers.
Some mental health issues that are common, really common in Nigeria include anxiety, depression. Everybody has, almost everyone has an experience with anxiety or depression. The situation of the economy itself can speak for itself. So the most common in Nigeria, mental anxiety and depression.
We thought if everyone is at home, it doesn't mean we also have to be at home idle. We could do something from home, right? And that was where we started. We put together a team of volunteers, around 15 people, and mostly lay counselors that we've trained in the past, and decided to set up a free counseling program. So people reach out to us via WhatsApp, and then we allocate a counselor to speak with them. And in the first month of doing that, we offered counseling to over 100 people. We collaborated with other organizations who were referring people that were reaching out to them. The Sunshine Series was founded 5 years ago, but I think the seed was planted over 10 years ago. I am from Borno State, and Borno State is where the insurgency started in Nigeria, and eventually it trickled to many other states, including northwestern states like Kano State, where I was born and raised. But so the whole experience with the insurgency, the losses we experienced, the deaths in the family, the displacement, were all issues that affected myself and my family. And I was fully aware of how there were so many interventions put in place by the government to support and also end the insurgency in terms of security, in terms of safety, but there was not much priority given to the psychosocial needs of survivors, the trauma experienced, how it just keeps lingering, the kind of fear it puts in you, the way it affects your normal functioning.
I first heard of Sunshine Series before Idimma, actually, and that was like 5 years ago during the COVID. And a friend of mine told me about the organization, and I was so impressed with the fact that they were ready to provide free mental health counseling for people, and that is one of the huge barriers that we have in Nigeria. And I was so happy, and I was like, I just have to be part of this.
With the lack of access to mental health professionals, and obviously the amount of time it takes to train them, we looked at how we can bridge that gap in access to care, and that is where we looked at the model of training lay counselors. Now, that approach is simply put task sharing. So where some of the workload of the limited mental health professionals that we have can be taken by others who are trained to provide basic support. And the reason why lay counselors are very relevant is because not every single person who has a mental health difficulty requires seeing a psychiatrist or a psychologist. Sometimes they can work with a lay counselor, receive some form of psychological first aid, and they are fine and good to go.
I was just at the right place at the right time, and I happened to meet Aisha Buba. She came as an expert and was now scrutinizing the other ladies' project. And I found it fascinating because of the things she was now saying. And I think at that point I realized that I really didn't know anything about mental health. At the time, it wasn't as popular as it is now in Nigeria.
We look at different right holders within the society and train them. We look at people who have access to more people that they can support. We're looking at primary healthcare workers. We're looking at the police. We're looking at media professionals. We're looking at NGO humanitarian workers. So teachers, these are all people who have access to the general populace. So when we train them, they can provide basic mental health support. There are people in grassroots communities. How about their mental health? Well, that was where we decided to reach out more for partnerships, and that's how our partnership with the federal government of Nigeria came through, where we looked at how we can ensure more people are also supported in this manner, and that's where the 112 helpline was born.
Psychologist Aisha Abdullahi heads the team of counselors manning the helpline. She started free online counseling last year after seeing a significant jump in the number of mental health cases after the pandemic began.
The virus has done a lot of damage to societies across the world, economically, socially, politically, and health-wise. That's why counseling becomes a very, very important instrument to control and to manage the behavior of people who have been affected.
Working in the communities that I work, I tend to feel helpless because a lot of times you give support, you give, the intervention that you can give, but then there are certain things that you really cannot help with. So partnership with organizations like Sunshine Series, are really, really important for me, because if I know that you need mental health support, I can say, call this number.
Most recently, now I'm female, you would think there should be a gender thing happening, and he was a young man and just 20 years old, and he was suicidal, and he was telling me how he has spoken to a lot of people, he wasn't working, nobody seems to understand, and I just listened to him, and I was able to pick from what he was saying, and I wasn't trying to actually say this is what you should do, just listening to him, allowing him vent in a safe space. At the end of that 1 hour, he was laughing, and it was like we were able to pick out of every negative words being thrown at him that has really got him a lifetime of pain and trauma. We were able to pick out the compliments people have. It was as simple as identifying what are the kind words anybody have told you. And by the time we got it together, he took a look at himself and was like, I am actually good. I'm not useless. So that made me just feel like, wow, I'm at home. If I see him today, I won't recognize him. He doesn't know me too well. It was just through the phone, and I provide support for a young man ready to end it all, and he's saying thank you for listening to me.
112 has really impacted a lot of life, especially I think we've handled a lot of cases like suicide attempts. I could remember a night where I got a call where somebody wanted to commit suicide, and I personally am the one that handled the case. I just talked to the person that they should remove everything around that can harm the person, and I continue engaging the person, until she gave back her composure.
So 24/7 people could call. We had counselors on duty who were taking shifts. People could call in. We had so many calls, provided support for different issues, depression, anxiety. Sometimes we got suicide calls. We've had to work with the ambulance and the police to do suicide rescue in the middle of the night. Sometimes we get calls related to domestic abuse or sexual violence, where we've had to make referrals to NAPTIP. So that's how the 112 helpline has been running so far. Used Abuja to pilot and see where our gaps were and what to work on before we consider moving to other states.
And secondly, we'll be airing online. We've been doing radio programs where we've been doing a lot of radio drama where you can easily listen to us, where we are creating awareness on mental health issue.
For a very long time, mental health has been associated with so many negative cultural norms, superstitions, beliefs, most times attributed to spiritual causes, even when they are clearly medical, but people don't know better, right? So we understood that gap and then decided to leverage providing mental health education. So that is where our radio drama comes in. That is where us leveraging digital media comes in. That is where we hosting symposiums, events come in trying to create awareness. That is where us training media professionals to tell more stories about mental health comes in.
The 112 helpline is brought to you by the Sunshine series with support from the Nigerian Communications Commission.
Then lastly, we also engage in advocacy and policy influencing. So that's where we work with policymakers, advocate for a better mental health law, better mental health policies, ensuring that these policies are domesticated across all states to ensure that there is basically a better roadmap for improving mental health services in Nigeria. In terms of organizational support, we've received support in two ways. One is capacity building, strengthening our capacity through prestigious fellowships like Echoing Green Fellowship, Mandela Washington Fellowship, Yali Regional Leadership Center, the Atali program, Little Big Funds program. These are all programs that have helped to build our capacity as a social enterprise, ensuring that our structures are in place, our team is performing optimally, sometimes even providing well-being support.
Mental health is one of the most important things on this planet, and Aisha and her team have found a way to really target and support people who need mental health support in their country, Nigeria. Anyone wants to get involved in a more direct way by supporting the organization and joining the board, etc. But what is needed is really funding to drive this process forward.
So here at the Leprosy Mission, we work in different thematic areas. And within the thematic area of mental health where we work in, we implement mental health initiatives that improve the mental health of community members and ensure that they can live their lives to the fullest. What our initiatives aim to do is just implement community-based mental health care, as well as empower the government structures that are already existing in these communities, such as primary health centers and so on, and just ensuring that they're able to provide that level of support for the individuals. Even more, it provides livelihood support to these individuals, because aside from the mental health issues they're going to, you have the psychosocial disabilities that impact how they interact with members of the community, members of communities around them, and ensures that they're able to sustain themselves beyond what the Leprosy Mission does for them. So I think the process for training them started from not just assuming that everybody that was being trained knew what mental health and mental illness was. It was taking them through the process of understanding what mental health issues are, what mental health is, what good mental health looks like, what bad mental health looks like. And then it progressed into looking at specific mental health disorders and how those affect daily lives, how those affect individuals. That was then contextualized to fit the Leprosy Mission Nigeria's work, and how mental health issues can present themselves with our community members and even staff members.
As a hybrid organization, it was quite tricky for us trying to navigate our programming. So here we have the Sunshine series, which was designed to run as a social enterprise, but because of the format in which we were registered, we experienced a lot of challenges, especially in trying to access external funding to support our work. So that's where Idimma was registered 2 years down the line. That way they could function as a hybrid model where they are aimed towards the same mission and goal, but the way both organizations raise funding now differs.
We have like 14 modules that they are supposed to go through for 16 weekends, and the training was for 9 months. And some of the modules that they had to go through modules like project management, advocacy skills, communication skills. And then there are other modules where they are open to interact with themselves or with what is happening within their environment, including the international issues, so that they are conversant with that. And then most especially build their capacity in engaging in constructive criticism.
Page Initiative is all about, giving people a platform to be the best that they can be. I mean, for even the people, the population that we serve, Page Initiative gives a platform for people that are underserved in the society to, get an opportunity to be heard.
Primarily, our interventions are divided into 4 segments for both organizations. We provide direct mental health services, so like therapy, counseling to individuals, families, groups. That's our own way of, because we also have psychologists within our team. I'm a psychologist myself, and I still work with clients in therapy. So that's one angle to the work that we do.
So our relationship so far has been a very good one. It's been very fruitful, informative, and I think mutually beneficial. The Sunshine series has provided us psychologists at times where we have community engagements. They've been able to train some of our counselors on mental health interventions and psychosocial therapy and things like that. So it's been a really fruitful one.
Other partners like Friedrich Ebert Stiftung, Nigeria office, government partners like the Federal Ministry of Special Duties and Intergovernmental Affairs, the Nigeria Lottery Trust Fund. These are all partners that have engaged with us, supported the work that we do. There's so many of them out there that amplify the work that we do. Nguvu Collective also strengthened us, our advocacy arm, in terms of knowing how to engage with policy makers, how to influence policies, how to amplify our services and the interventions that we run through different media channels.
This also helped our team to be able to open up, to be able to talk about. So it's sort of like a platform also for them to share their own things that they haven't shared with others before, things that are affecting them.
After that project, that training ended, they didn't just leave us without resources. They provided resources on depression, anxiety, and the first thing that happened was I thought I was learning because, of course, I work in the development space with women and girls. I would be able to help them, but I thought that I was getting helped. So I got help for myself first. I understood my triggers, and I was like, oh my God, this is mind-blowing. Everybody should know about mental health, and I know the triggers and how to get support and everything. I can say it also helped me that period, because when people say, oh, my lockdown was awful, for me, I was learning and I was helping other people. And it kind of helped me go through that whole period.
We've been partnering with the Sunshine series and Idimma, the NGO component of Sunshine series, on a lot of other issues. I mean, last year it was, for the 16 days of activism against gender-based violence, we wanted to talk to women in communities who have been affected by gender-based violence, and we partnered with Idimma, and it was, a chance for these women to kind of talk about their issues and also know that there's a line that they can call. So, for the wider population, it has been of immense benefit. This year, we actually worked with persons with disabilities, still in partnership with the Idimma series, and they were also able to talk about, the mental health component of their disabilities that are attached to it. So, I mean, in future, we always we know that we have a lot to do with Sunshine series, because the population that we serve, it's important that we also think about their mental health. And since we are not equipped, to do that, the partnership has been of benefit to our society.
Providing psychological first aid to police officers in Kaduna Metropolis. So that also is something that, brought so much joy to me, because police officers are first responders, and that's all we know them to be, so wherever there's crisis, they get called upon. So the aftermath of that, how they handle the crisis, what the effect was on them, how they cope with it, is no one cares. So taking the psychological first aid to them, teaching them how to best respond to crisis situations, how to self-help themselves also, so that they don't leave crisis situations with backload of trauma, PTSD and all of that. And the feedback that we got from them was amazing also. They were so glad that the training came to them, so it was really impactful.
So far, we've had the lay counselors who were trained go out into the communities and actually train peer counselors. These peer counselors lead our peer groups in the communities, and these peer counselors are responsible for their community members. So they have groups of 10 community members that they interact with more or less on a daily basis, and our lay counselors have been able to step down the training that they received to these peer counselors. So you find that a lot more community members are able to identify, able to provide brief intervention, and then able to refer their community members and their group members to further psychiatric or psychological care, which has been very important for us.
The major challenge that I have faced in my line of work is acceptance, stigma. There is still that barrier. So whenever you're talking, people still see mental health as if it's not a real thing. We have this very dangerous cultural narrative that views mental health as though it's a concept, a Western concept. We still view it as if it's alien. So people here still have this wall when you're trying to approach them and talk about mental health issues. And if it's not something that an injection will cure or a tablet that they will swallow will cure, they don't believe that it exists. And they say, what do you mean by when you talk to me, I would feel better? So there's still that wall.
In terms of growing pains, there are so many, but I think I will start with the human resource. A lot of our work is more human capital intensive. So we need people who are experts. We need people who are qualified. We have a team that has psychiatrists, psychologists, social workers, counselors, psychological first aiders, sometimes even legal, right? So they have to be people who are experts in their field, who know what they are doing. We've had to work with sometimes professionals from outside of Nigeria, so having access to this number of people has been a major challenge. So having to sustain that stream of funding to be able to keep going has been a major challenge for us. Safeguarding also sometimes can be a challenge because we do the work that we do. We maintain a lot of confidentiality. We safeguard and protect our beneficiaries.
So the partnership between Page Initiative and Sunshine Series and Idimma is here to stay because we have seen the benefit. We go to the communities. We know where there's the most needs, and we can always let them know, okay, this particular population, we need to do something around it. And I think there's no time that I've reached out to the Sunshine Series and they have not come through. They always come through.
So I think with the 112 helpline, if this can continue in the next future, Nigeria will be a better place because this will reduce the rate of suicide attempts and it will prevent people from harming themselves.
The importance of providing early intervention before situations escalate cannot be overemphasized. The reason is because early intervention, like they say, prevention is better than cure. But this time around, we are not preventing per se, but we are trying to nib excesses in the bud. So when these issues are caught early and coping mechanisms are put in place early enough, it helps to reduce the distress that the person would face if the situation would worsen. So early intervention is very, very important. It also helps to cut down costs in treatment because at that stage, the person is probably able to apply some of these mechanisms by themselves before professionals are brought in hand where the situation probably have gotten worse.
So creating awareness around mental health is more like a digital role, in as much as we have outreach and all those things that we have done they are being put into videos, into audios, into graphics, into images, and it's put online for other people to see and know about the whole awareness surrounding mental health.
I believe that more people will become self-aware and more knowledgeable and sensitized about the issues of mental health, and also that culture of seeking help, knowing it's okay to reach out when you're going through a rough patch.
Having a mental health issue doesn't mean that you are now crazy or anything, but it's good for you to manage your mental health for your own sanity and for your own peace and the peace of people that are around you.
For me, it has helped me a lot. Like, sometimes I go through something. We all know the way Nigeria is now. You can just wake up in the morning and something can just want to affect your mental well-being. So one thing it has helped me to build resilience to a lot of things that is going on that I can just come across anytime, and these are things that I can't control. So it has really helped me, and I've been able to influence the people around me.
Interventions beforehand, structures in place beforehand would save a lot of lives. Just as it is for physical health, same thing applies for mental health. We didn't want anybody becoming dependent on us to be able to access mental health services. So that's where we train lay counselors in communities, in different places, religious leaders, traditional leaders, the police, different people. That way they can provide some sort of basic support and link people to further care, right? So that's our own way of ensuring the work that we do is sustainable.
Nigeria in the next 5 years, if we keep up the pace where we're going with having the open conversations that we are having right now, encouraging mental health awareness as much as we are doing, or doubling the efforts, even have government collaboration be included in the budget also, then the sky will just be our starting point. My vision is that every organization, every government organization, ministry or parastatal, has a mental health unit where employees can walk in, know without any fear of repercussions or judgment, speak their minds, get the help that they need, and with trained professionals who understand the aspect of confidentiality and ethics, give the help that these people really need.
We are also part of National Suicide Prevention Advocacy Group. The group is just to decriminalize suicide in Nigeria. We've also launched the National Mental Health Policy and the Suicide Prevention Strategic Framework. It's online, it's on our website if you want to read it and want to check it out.
As many lay counselors as we can train, the better for the Nigerian health context. And I think that the partnership between the Leprosy Mission and the Sunshine Series will be a very crucial one in ensuring that we have more lay counselors trained, and therefore mental health service delivery is wider in Nigeria.
We've built this capacity in Nigeria. We've done so much of our work, and we've seen the gaps, we've innovated, we've invented, we've done so much that we are now saying we want to share how much of capacity we built in this sector with the rest of the world. And that is why we are creating this app, the Mind WellNest app, to provide mental health services to individuals. We fought the stigma against mental health for a while, but that stigma still remains, it still persists, and we don't want to spend too much energy fighting the stigma, while we could use that same energy to just provide the services for people, meet them where they want to be met. So that's why we're leveraging tech to create a digital app that would provide therapy, that would provide education on mental health, that would provide access to psychiatric evaluation, that would provide access to other wellness tools like meditation, that would also even provide access to medications for people, right? Have medications delivered to them from wherever they are, especially for people whose symptoms are so severe that it's difficult for them to take action, to step out of their rooms to go and seek care. And our app is also focusing on providing these services for Black people and Africans across the globe. And providing the service by people that look like them, by people that talk like them, by people that understand their cultural context, that understand their way of life, right? So that is what we are trying to do. And through that app, we also want to build the body of data, mental health data, African mental health data, because we have a weakness in that. We rarely have enough substantial mental health research and data that can inform interventions. Through this app, we want to be able to do that. We want to be able to also leverage research and be able to build interventions that are specifically curated for our kind of people. So that's what we aim to achieve with that.
As we reflect on this journey, we see more than just numbers or services. We see lives transformed. We see communities healing. We see a future where mental health is not a whispered secret, but a celebrated priority. The road ahead is long, but the path is clear. The Sunshine series has laid a foundation for sustainable mental health care in Nigeria. Together, we can empower minds and change lives. Visit the Sunshine series website, download the mobile app, or call 112 today.